Vagus nerve, this is the 10th cranial nerve and this is a mixed nerve. The vagus nerve is so called due to its vague distribution to the head, neck, thorax and abdomen. The cranial part of the accessory is also joins with the vagus nerve for its distribution. Then next is about the functional component. The general somatic afferent, this carries general sensation from the skin of the external ear to the spinal nucleus of trigeminal nerve. The next one is the special visceral afferent. This carries taste sensation from the posterior most part of the tongue and the epiglottis to the upper part of the nucleus of tractus solitarius. Next is about the general visceral afferent. This carries general sensation from the pharynx, larynx, trachea, esophagus, thoracic and the abdominal viscera to the lower part of the nucleus solitarius. Then the special visceral efferent, it carries motor fibers to the muscles of the palate, pharynx and the larynx that arises from the nucleus ambiguous. Then general visceral efferent, this carries parasympathetic fibers to the thoracic and the abdominal viscera arising from the dorsal nucleus of the vagus nerve. Then next is about the nuclei. The nucleus are nucleus ambiguous, dorsal nucleus of vagus, nucleus of tractus solitarius and the spinal nucleus of trigeminal nerve. This nucleus ambiguous, it gives motor fibers to the muscles of the palate, pharynx and the larynx, and the dorsal nucleus of the vagus, it gives parasympathetic fibers through the thoracic and the abdominal viscera, and this nucleus is a mixed nucleus. It has both the sensory and the motor. Motor is both the visceromotor and the secretomotor, and the sensory viscerosensory, and the fibers taking origin from this nucleus, they form the main bulk of this vagus nerve. The next is about the nucleus solitarius. The upper part of the nucleus tractus solitarius receives the taste sensation from the posterior most part of the tongue and the epiglottis, and the lower part receives the general sensation from the pharynx, larynx, trachea, esophagus, thoracic and the abdominal viscera, and the spinal nucleus of the trigeminal nerve, they receive general sensation from the skin of the external ear. That's all about the nuclei and the functional component of the vagus nerve. Next we will study about the cause and relations of this vagus nerve only in the head and neck. For that we will separate the cause into intraneural cause, intracranial and the extracranial cause. And the intraneural cause, this fiber arises from the all this nucleus and they run laterally between the inferior cerebellar peduncle and the inferior olivary nucleus. They get attaches to the posterolateral sulcus, becoming the intracranial cause. Intracranially, this nerve attaches to the posterolateral sulcus by about 10 rootlets. Then the fibers run laterally and they all unite and form a single trunk, and they enter into the intermediate compartment of the jugular foramen, and within the foramen this nerve present and superior ganglion and leaves the jugular foramen and enters into the skull, reaches the base of the skull, becoming the extracranial part. Then we will see here the extracranial part of the vagus nerve. See, this it is arising from the, that is intracranial part is arising from the posterolateral sulcus and entering into the intermediate compartment of the jugular foramen, and it leaves the jugular foramen. Within the jugular foramen, this nerve has an superior ganglion. Once it leaves, then it becomes the extracranial cause. At the base of the skull, this nerve, it presents an large ganglion which is called the inferior ganglion. This is called the inferior ganglion of vagus nerve. Then this nerve, it descends vertically downward between the internal jugular vein and the internal carotid artery, between the internal carotid artery, internal jugular vein and the common carotid artery. Then this nerve on the right side, it enters into the thorax by running in front of the right subclavian artery. On the left side, it runs between the left common carotid and the left subclavian artery to enter into the thorax. This is about the cause of the vagus nerve. Next is about the branches. The branches from the superior ganglion, the branches are meningeal branch and the auricular branch. Now the meningeal branch, it enters into the posterior cranial fossa and supplies the dura over the posterior cranial fossa. Then this auricular branch, it leaves through the mastoid canaliculus and the tympanomastoid fissure to supply to the tympanic membrane and the external acoustic meatus and to the skin over the auricle. This is about the meningeal and the auricular branches. These two are the branches from the superior ganglion. Next about the inferior ganglion, its branches. This is the, it gives of three branches, that is pharyngeal branch, carotid branch and the superior laryngeal branch. Now this pharyngeal branch, it descends downward and forward between the internal carotid artery and the external carotid artery, and this runs ends on along the upper border of the middle constrictor, and now this take part in forming the pharyngeal plexus by joining with the pharyngeal branch of the glossopharyngeal nerve and the sympathetic fibers, and through this it distributes to the muscles of the pharynx and to the muscles of the soft palate, except the tensor vale palatini that is supplied by the mandibular nerve. Next branch is the carotid branch that supplies to the carotid body and the carotid sinus. Next is about the superior laryngeal branch, and superior laryngeal branch, it runs downward and forward medial to the internal carotid artery, and this divides into two branches, that is internal laryngeal branch and the external laryngeal branch. Now this internal laryngeal branch, it pierces the thyroid membrane and supplies to the valvulae, pyriform fossa and the mucous membrane above the supraglottic part of the larynx. And this external laryngeal nerve, this accompanies the superior thyroid artery and goes deep to the lobe of the thyroid gland and supplies to the cricothyroid muscle. Then next is about the trunk branches, that is it gives of cardiac branch and the right recurrent laryngeal branch. Now this cardiac branch, they of both sides, they take part in forming the superficial and the deep cardiac plexus, and this plexus mainly concerned with the reflex inhibitory activity of cardiac muscles. Then the next one is about the right recurrent laryngeal nerve. Right recurrent laryngeal nerve, it is a branch from the right vagus at the level of the root of the neck. Then this nerve, it winds the lower surface of the right subclavian artery, then it ascends upward obliquely behind the common carotid artery and enters into the tracheoesophageal groove to supply to the cricothyroid muscle. To supply to all the muscles of the larynx except the cricothyroid muscle. The cricothyroid is supplied by the external laryngeal nerve and also to the mucous membrane over the infraglottic part of the larynx. This is about the branches and the distribution of the vagus nerve. Next we will study about the applied anatomy. If there is any irritation over the auricular branch by means of an ear wax, that causes an persistent cough, that is called the ear cough. And if there is any stimulation over this auricular branch, that increases the appetite. Then if there is any injury to the pharyngeal branch, the muscles of the soft palate get paralyzed and this result in dysphagia. Then the next one is, if there is any injury to this recurrent laryngeal nerve, especially on the right side, this leads to the hoarseness of voice. Thank you.